the frontal sinuses are right here, and the sphenoid sinus is sort of in the middle of the head.
That's correct.
Back in the head. So we're going to design where we can open those with balloon surgery in the office. Tell me about that.
Right.
What's it called first?
Well, balloon sinus surgery is, I mean, it's just another tool that we have in the armamentarium. It's still an endoscopic sinus surgery. So we use balloons in the operating room. We use them in the office. It's a fantastic tool that we have in our toolbox to help manage people that have problems. And we still use an endoscope in the operating room or in the office to be able to see the normal anatomy. But the balloons have gotten a ton better, and I'm going to show you a really neat one today that has an image guidance capability. So
image guidance.
So we'll take a CAT scan of someone's head, the same one we've used for diagnostics.
You take a CAT scan of this head.
Yep, exactly. And then we can use a computer to generate a three-dimensional model, and we can map that person's face and their sinuses with that three-dimensional model. And then in the balloons, the wire that helps us guide into the sinus cavity has a guidance tip on it, like a GPS signal that tells us where the balloon's going to end up. And we can guide that signal using some some screenshots of the CT scan, in addition to using our endoscope to be able to see the anatomy. And it's much more effective. It simplifies things for us. It cuts down on time and discomfort for the patient.
So you know the normal anatomy. You've got an instrument that will guide you, knowing the anatomy plus the CT scan that's three-dimensional, will tell you what sinus is. All of them?
It'll target the specific sinus. The CAT scan will tell us, is it frontal, is it ethmoid, is it sphenoid, is it maxillary, and which side is it on? So we can guide ourselves right into that specific sinus.
So show me what you do. Let's pretend like we're at your office and I'm on the table. Are you going to give me some local anesthetic, or are you going to knock me in la la land? What are you going to do?
So we often will use oral sedation, but the anesthesia is typically topical. So we'll put some lidocaine on some cotton pledgets up in the sinus cavity, leave them there for 20 minutes to numb the nose. Occasionally we'll inject in the nose around the sinus opening just so the patient has absolutely no pain, but you don't feel that because you're already topically numb. Some guys don't even use the injection, but I think in my experience, it helps the patient have a better experience. So we numb the patient topically. We then use the endoscope to look in the nose.
Show me the endoscope again. Let's show that up to the camera there.
We don't have an endoscope. This is the balloon. But an endoscope would be a rigid camera that would look like this. It would just have a fiber optic into it, and we would stick the camera in the nose, and the camera image would be projected onto a screen, so we would be able to see all the anatomy magnified in front of us. And then we can use the balloon, which has the wire that extends from it. We use our minds and our eyes to guide, but the balloon tip also tells us when we're smart and when we're not.
So show me when you put that in the nose, show me what it looks like.
So as you look at the top left-hand side, you can see that the tip of the wire is traversing into the nose. And now it's about to go in the sinus. If I get my scope, I'd slip it right in there for you. But
so when it goes into the...
There you are. So now we're in the sphenoid sinus.
There was a little ding-ding, so the GPS instrument tells you if you're inside the sinus or not?
That's correct.
Amazing.
It is really amazing.
So now you're ready to do the opening. You're ready to put the balloon in to dilate up the blocked hole.
Correct. So now that the wire is in the sinus cavity, we'll pass the balloon with another sliding piece of equipment over the wire into the sinus cavity. Then your assistant will inflate the balloon. It's a certain size, and it will dilate the opening of the sinus. And then we take the balloon down, deflate it.
You don't leave the balloon in there.
Nope, it goes home with me.
So you dilate up the balloon, then you deflate it, pull it out, and what has it done in there?
It's opened the sinus cavity. So what was once obstructed is now open. And the beautiful thing is, if you look at studies, there's great durability to this procedure. So the patients maintain patency and openness of that sinus just as long as they would with a traditional operation, opening it with, removing the tissue around the sinus opening. So it's fabulous, and patients basically drive themselves home after this. If we give them sedation, we have somebody drive them home. But if we don't give them sedation, they can just get local anesthesia and go back to work if they want.
You can go back to work that day or the next day, or
You could go back that day if you wanted to.
and so what we've done is we've got a blocked sinus that we've now unblocked. We've unblocked it by balloon sinuplasty or balloon surgery, and that keeps the sinus opening where it will drain for a long, long time.
Correct.
And that relieves the problem of obstruction.
And we're not cutting tissue and removing tissue, so the bleeding that was associated with traditional sinus surgery is basically alleviated with the balloon.
Do you get better results with balloon sinuplasty or the endoscopic sinus surgery that you did early?
They're both outstanding as far as results go.
That's absolutely amazing. Did you ever believe you'd be doing balloon sinus type surgery?
No.
And it must be very gratifying to be able to do this in the office where the patient doesn't have to go through the surgery and through the bleeding, et cetera.
We have patients that come in with pain in their frontal sinus. We'll dilate the frontal sinus and they'll leave saying the pressure is gone.